Well, good afternoon and welcome to H360 Live. My name is Dave Duplay, and joining me here in the studio is my friend and colleague from Healthy O360, Ms. Courtland Long. Well, Courtland, we have a great show for everybody today, and I can't wait to get it started.
We really do have an awesome show. A couple of weeks back when we were attending ASCO in Chicago, we had the great fortune of meeting Dr. Priscilla Brastianos, and we talked with her a little bit about her research in brain metastases, and we just recently had a Skype interview with her going a little bit more in depth, so it's going to be an awesome show.
Yeah, it really is. Sit back, enjoy the show, and we'll see you in just a little bit.
Dr. Brastianos, thank you so much for joining us today. We have so many members in our community who are living with cancer, and I think would really like to learn more about brain metastases. So can we start out by having you talk a little bit about your background in science?
So I am a medical neuro-oncologist at Massachusetts General Hospital. So I run a multidisciplinary brain metastasis clinic, and I also have a translational lab in brain metastases. And our goal is to understand the genetic drivers of brain metastases.
So doctor, how did you become so interested in the central nervous system and particularly how it's affected by cancer?
So brain metastases are quite a common and devastating complication of cancer. About 200,000 patients develop brain metastases every year in the US. And historically, many clinical trials in the US have excluded patients with brain metastases, and our understanding of the molecular mechanisms of brain metastases are very limited. So my goal since the beginning of my medical school career is to change that and to understand the mechanisms that drive metastasis of the brain and find new treatment approaches for this entity.
And so in your current research project, what exactly is the focus of that?
So my goal is to understand the mechanisms that drive metastasis of the brain and find new treatment approaches. So as I mentioned earlier, I started a multidisciplinary brain metastasis research and clinical program at Massachusetts General Hospital with our goal to study brain metastases. And we've also brought together a team of collaborators and colleagues from all over the world to create a large collection of matched brain metastases in primary tumors. And recently, new sequencing technologies, so that is technologies that analyze the DNA of cancer, they've been used to find new treatment approaches for cancer. And now we've used this technology to study brain metastases, and we're finding new targets in brain metastases that are not present in the biopsy of a matched primary tumor. And now based on these efforts, we're now initiating several clinical trials in brain metastases patients.
So with these sequencing that you're speaking of here, what are some of the therapeutic approaches that you guys are taking as you're discovering, and getting more information as you're sequencing these tumors? And where do you see improvement for this?
So the management of brain metastases typically requires a multidisciplinary approach, and treatment options include surgery, radiation, or systemic therapies such as immunotherapies, targeted therapies, or chemotherapies. And many of these treatments, including radiation therapy, can be associated with a lot of toxicities. And furthermore, many drugs that we use in oncology don't get into the brain. So we have a lot of work to do to optimize the management of brain metastases. And what my group specifically does is to look for new targeted therapies or immunotherapies for brain metastases patients.
So, Dr. Brastianos, I know that there's probably a lot of funding that goes into these research projects. And you were a Damon Runyon scholar. Is Damon Runyon helping to fund this, and where is the other funding coming from?
So I'm very grateful for the support from the Damon Runyon. So they're providing us with a very large and generous grant to study brain metastases. And I've received funding from other sources also, because in order to do these projects, you need funding. And so I've received funding from Damon Runyon, from the Susan G. Komen, from Concord Cancer Foundation, the Brain Science Foundation, the Terry Broder Foundation. And with NIH funding being so limited, we rely on these other sources such as foundation grants.
So, funding being scarce, people have funding, they're looking at different ways to apply that in different areas of medicine. So funding is one thing, but you have many accolades and awards over your career. Are there any that really stand out in your mind as being special?
So honestly, the best award for me is when we see a patient benefit from our research. So helping patients is why we do what we do, and that's more important than any accolade and award that we'll get. So for example, we recently studied a tumor called a craniopharyngioma, and historically these have been very difficult brain tumors to remove, and they're rare tumors, but they arise next to critical structures within the brain and can cause profound neurological symptoms, both in children and adults. And no chemotherapy has ever worked for craniopharyngiomas. And recently we did a study where we found clinically actionable mutations called BRAF mutations. These are the same mutations that have been seen in melanomas. And we found these mutations in 95% of one subtype of craniopharyngiomas. And we recently had a patient who came into Mass General Hospital with a craniopharyngioma that had recurred multiple times and required multiple emergent neurosurgeries. And so we treated him with a targeted therapy, and his tumor shrunk by more than 85% in 1 month, and he felt significantly better. And this is the first time that we've ever seen a craniopharyngioma respond to systemic therapy. So seeing our lab work translate directly to the clinic is tremendously rewarding.
That's fantastic. I can only imagine how exciting that would be to see a patient benefit directly from the work that you're doing and from your research. And so bringing this back to the patient experience, what are some of the risk factors of developing brain metastases? Are some individuals more at risk than others?
So there are certain risk factors, and that's actually an area of research right now. So we know that approximately 30% of advanced HER2-positive breast cancer patients will develop brain metastases, and approximately 40 to 50% of metastatic triple-negative breast cancer patients will develop brain metastases. This is an area that we're studying right now.
You know, Doctor, you speak of in your work as having a multidisciplinary team, and it sounds like some of these metastases and brain tumors affect certainly the central nervous system, which probably translates, I would expect, into mobility issues and things of that nature. But what about the mental and emotional issues that a brain metastases can have on a patient?
So depending on where they're located in the brain metastases can have a profound impact on the emotional, mental, and physical well-being of a patient. So brain metastases can cause severe headaches, they can cause seizures, they can cause personality changes, and this can often be very difficult for patients and their families.
So for you, what's the hardest part of conducting research on patients living with brain metastases?
The hardest part is telling patients that many clinical trials in the US exclude patients with active brain metastases. And so my goal is to change that.
That's very interesting. Again, getting back to this collaborative approach, working with patients and seeing patients and dealing with that every day is one thing, and then going into the lab and kind of doing your research is another. How does that all coordinate and kind of culminate and come together to deliver the best quality of patient care that you guys can deliver?
Yeah, we have a team of colleagues and collaborators both here in Boston and internationally working together to solve the problem of brain metastases. We've created a large tissue collection of brain metastases that we're studying, and we have a multidisciplinary team of colleagues that are studying these brain metastases now. We can only make significant dents in the progress of medicine when we work together in synergy.
Why is it that so many patients will develop secondary tumors in the brain?
So that's a great question, and it's a question that we're still trying to answer. So our goal is we're working on understanding if there are specific genetic changes that predispose cancers to spread to the brain.
So once a patient develops a brain metastases, how does that affect the likelihood of survival of that patient?
Sadly, approximately 50% of patients who develop symptomatic brain metastases will die of their brain metastases. So there's a huge need to find better treatments for these patients.
Earlier you had mentioned matching the brain metastases to the primary tumor in the body. Is there a significant difference in brain metastases and the underlying cancer from which it arises?
This is also a question we're still trying to answer. So when we looked at the genetic characteristics of brain metastases and compared them to their matched primary tumors, we found that brain metastases and the primary tumor shared a common ancestor, so they did share some mutations, but then there was significant divergent genetic evolution, meaning the brain metastases then had additional clinically actionable drivers that were not detected in the biopsy of the primary tumor.
You know, Doctor, you were speaking earlier about the different forms of treatment. You mentioned earlier radiation, you mentioned surgery, you mentioned chemotherapy, and now this new immunotherapy and personalized medicine. What are some of the factors? You see a patient come in, you diagnose brain metastases. What are some of the factors that are going to determine which course of treatment that patient's going to receive?
That's a great question. So multiple factors are used to make these decisions. And the management of brain metastases, as I mentioned earlier, is multidisciplinary. And decisions are made based on a variety of factors, and this includes, but is not limited to, so it includes the location of the brain metastasis, the burden of the disease in the brain, the burden of the cancer outside of the brain, the primary histology, such as breast, lung, melanoma, etc., how much prior treatment the patient has already gotten, or how sick the patient is. So that's an example of all the different factors we use to make the decisions about treatment.
So we spoke a little bit about clinical trials, and you mentioned that many clinical trials in the U.S. exclude patients with brain metastases because they are so sick. Are there any clinical trials in the U.S. that patients can currently participate in?
So there are several national trials in brain metastases. We also have several trials in the pipeline at Massachusetts General Hospital Cancer Center. A good resource for clinical trials in oncology is www.clinicaltrials.gov. And by looking at that website, you can see what trials are available, not just for brain metastases, but for other oncologic trials also.
So I think I know the answer to this, but I'm going to ask it anyhow. So, you know, doctor, what inspires you? I mean, you're dealing with some pretty heavy things here, both in research and patient care. You talk about, unfortunately, the survival rate of patients that come in and present with a brain metastases. What inspires you as a physician and as a person to come to work every day and work so hard in this area?
So for me, it's a deeply personal journey. My grandmother was diagnosed with breast cancer when she was 23 years old, and she died when she was 29, and she was a physician in Greece. My mother sadly recently passed away from breast cancer at the age of 57, and I miss my mother every day, and I'm reminded every day that we need to find better treatments for patients with cancer. Too many people are still dying of cancer, and we need to change that.
That is very inspirational, and breast cancer runs in my family as well, and I know Dave's family has also been touched by breast cancer, so it's great to see that you and your team are trying to find better treatments for people so we can have everyone live longer and happier, healthier lives. Dr. Brastianos, how can our audience find more information about your research at Mass General?
So you can look on the Massachusetts General Hospital website, but also my lab has a website, so it's just brastianoslab.mgh.harvard.edu. So feel free to look at that website.
Excellent. So doctor, thank you for spending time with us today. You know, we have quite a significant community of patients and caregivers that are going through the cancer journey. As a physician and a researcher and a scholar, any final words for our community around this area?
Having lived through my mother passing away from metastatic breast cancer, I know that the diagnosis of cancer is a very difficult journey. So take one day at a time. There is hope. Given the pace of research, I'm certain that as a field, we will continue to make great strides in finding more effective therapies for cancer in the near future.
Well, doctor, thank you so much for joining us today, and we wish you all the best, and let's stay in touch. I'm very interested in the research you're doing. And so keep up the good work, and we'll check in with you periodically. And again, thank you so much for coming on H360 Live.
Of course, my pleasure. Happy to help.
Well, Courtland, that was a really great show.
It was excellent. It was so interesting to learn all about Dr. Brastianos' research and getting more information out there about clinical trials, especially for people who are sometimes considered too sick to be in them.
You know, Mass General is really doing some great work up there. They're on the leading edge of science. And so for everybody up there, we'd like to thank you for doing all the great work that you do. Dr. Brastianos, we'd like to thank you for Skyping in and spending some time with us. As always, we'd like to thank our sponsors for making this all possible. Remember, all of our episodes can be viewed on demand at healthy360.com, and our podcast can always be found in the iTunes Store.
Well, we love social media, and we're all over Facebook, Instagram, Twitter, and Pinterest using the hashtag #RealStories when posting, and we'd greatly appreciate it if you would do the same. On behalf of Dave Duplay, myself, and the entire Healthy360 family, we'd like to thank you again for joining us today, and we look forward to seeing you again next week when we're chatting with Andrew Ritter.